the Social Justice Assistant for SOURCE, which is the community engagement organization for the 3 health schools here at Hopkins. This is the second part of our series on highlighting immigration and health. We had a film screening on Monday that hopefully some of you were able to join us for. If not, I'm going to put in the chat a recording of that discussion and screening. We had a great discussion about how immigration is a public health issue, and we hope to continue this conversation today and moving forward. Before we start, I did want to take the time to acknowledge that we are on the rightful land of the Piscataway people, the indigenous people who are traditional owners of the land in the Chesapeake Bay region. I also wanted to acknowledge and sit with the discomfort of the way racism, white supremacy, systemic and institutional oppression, including but not limited to the practice of police brutality, redlining, colonization, state-sanctioned genocide, ethnic cleansing, forced removal, erasure, psychological trauma, and land theft impact the lives of Black and Brown folks in your geographic region, but especially here in Baltimore. And so with that, we can move on to our panel discussion to introduce Allison Pendrak from CASA de Maryland, Katherine Phillips from Esperanza Center, and Margie Simon from Erica. To give you a bit of a background on these organizations, CASA de Maryland works to organize, advocate for, and expand opportunities for Latino and immigrant people in the state of Maryland. They work closely with Latino and other low-income immigrant communities to improve the quality of life and fight for equal treatment and full access to resources and opportunities, and advocate for social, political, and economic justice for all low-income communities. Esperanza Center is a comprehensive immigrant resource provider that welcomes thousands of immigrants to the United States each year. Their mission is to welcome immigrants by offering hope, compassionate services, and the power to improve their lives. Every day, the Esperanza Center strives to empower clients to overcome barriers that stand in their way of their full participation in the American experience. And the Episcopal Refugee and Immigrant Center Alliance, ERICA, works to provide post-resettlement services to refugees and assist immigrants with their adjustment to life in the US. In their work, they aim to provide immediate and practical assistance to refugee and asylum seekers, partner with other community organizations, and empower the refugee community with information, networks, and guidance. And so now that we know a little bit about these organizations, maybe we can turn it over to our speakers to introduce themselves personally and their roles. So how about we start with Allison?
Hi, good afternoon, everyone. My name is Allison Pendrak, and I am the Youth and Evening Programs Manager at CASA de Maryland. I've been working with CASA for 3 years now, actually starting out as a volunteer, and then I was hooked, and I've been with CASA in various different roles ever since. And I'm excited to be here and talk to you all, and thank you to Lydia for inviting me.
Thank you. We're so glad to have you here. Can we do Katie next?
Hi, everyone. I'm Katie Phillips. I'm the medical director of the health clinic at the Esperanza Center. I'm a nurse practitioner by training, and actually I went to Bloomberg for a master's in public health, and I also went to the School of Nursing there and was active in SOURCE. This was, I guess, more than 10 years ago now, but it's really nice to come full circle, and thank you all for your interest in serving this population.
Thank you so much. Margie, if you want to go ahead.
Okay, thank you. Hi, my name is Margie Simon. I'm a retired librarian. I began my career as a medical librarian at the University of Maryland Health Sciences Library and ended my career as a school library media specialist in Baltimore County. And I've been volunteering for ERICA, the Episcopal Refugee Immigrant Center Alliance, since 2017. So I'm actually kind of sitting in for Betty Symington, who's the executive director, because she's a staff of one, and she had her vaccine yesterday, so she wasn't feeling well. So she asked me if I would sit in. And I should just say, I'm huge fans of the Esperanza Center and CASA. You're wonderful, wonderful organizations. So it's an honor to be on a panel with you.
Thank you so much for joining us. Maybe we can start with Katie, because you mentioned that you did an MPH here at Hopkins and was also with Source. And so my first question, and this is open to everyone, of course, is how did you get involved within immigrant and refugee communities, and kind of what was your career path and how did that lead you to working on these issues?
Yeah, sure. So I guess it started when I finished undergrad and joined the Peace Corps, and I served in the Peace Corps in Latin America. And that was when I sort of fell in love with the Latino culture and the language and all of it. And then came back and went to Hopkins for graduate school and knew that I wanted to continue to serve the immigrant community. So about 4 years ago, I took a job as a clinician at Esperanza Center. And then about 2 years ago, I stepped into a leadership role running our health clinic. So that's kind of the short answer of my path.
Great, thank you for sharing and showing how that pathway can go from Hopkins to community engagement. Allison, do you want to speak about your experiences and how you got involved with CASA de Maryland?
Yeah, sure. So I completed my undergraduate degree a few years ago. I actually studied biology and Spanish. And right now I think I'm using more my Spanish degree than my biology degree. But all of that experience kind of led me to where I am now. So after I graduated, I was working in Costa Rica and doing environmental education in Spanish. So I kind of fell more in love with speaking Spanish and working with multicultural groups. And after that experience, due to the political climate around that time, I decided it was really important for me to use my Spanish skills and support the immigrant community. So I ended up doing the AmeriCorps program with CASA, and my first position was helping community members fill out their citizenship applications. And then through time and with some of the education background and volunteering I did throughout college and the environmental education work that I've done, I ended up in the role that I am now as the youth program coordinator and now manager. So we are working with youth here in Baltimore City, immigrant youth, and giving them the tools to be empowered. And it's been a great experience.
Thank you for sharing. And Margie, do you want to share how you went from more in working as a librarian to eventually working with Erica?
So my synagogue, because it's a community congregation, partnered with Erica to provide services to a group of asylum seekers living at Gilead House, or Gilead House at St. Mark's on the Hill, which is a church in Pikesville. I'm co-chair of a committee at the synagogue that works with the residents of Gilead House. The committee formed out of a desire to help with the refugee surge in 2016. So this is after I retired. In fact, this is one of the reasons I retired, because I wanted to do more of this type of work.
Okay, thank you for sharing. And I think that brings us into our next question pretty well. And Allison, you kind of mentioned that the political climate of the past few years is what kind of inspired you to start getting into working with immigration and refugee populations. And so I would say, I guess generally, how has the political climate changed and how has that impacted the work that you're doing? Or if that has impacted the work that you're doing, and in what ways?
Yeah, so I can start. So the political climate the past few years has been very difficult and challenging, particularly for our immigrant youth and their families. I can't really speak to the clinical aspects of it, and I'm sure Katie can add to that. But just observing the effects that the climate of uncertainty has had on my students and my family's mental health, and in the pandemic as well, the disproportionate impacts that it has had on our families physically, all of that combined has been very, very difficult for our families, needing additional supports. And that's why I'm so grateful that we do have a partnership with a club at Hopkins called Salud. And students do come in every other week to do mental health sessions and lessons with our students. And really opening that conversation, giving them that safe space to talk about those things, maybe things that they don't even feel comfortable talking with their parents about, I think is really important. And yeah, it's been hard on our staff at CASA as well. Just being in that space where students are so fearful and worried about things that they shouldn't be worrying about at those young ages, wondering if their parents are gonna come home from work or if ICE is gonna pick them up. Those kinds of things are questions that students have in their head, in the back of their head, when they're on the bus, when they're coming to program, when they're going to school. And you can imagine that it is difficult for those students sometimes to fully focus on the things they should really be worried about, like getting good grades, going to school every day, and just being a kid, really. So, yeah.
Yeah, that's an excellent point. And I think, especially now more than ever, I feel like those anxieties and fears are have been ramped up. Katie, do you want to jump in and talk about your experience?
Yeah, I was just going to comment. So it might be helpful to give a little context. At the Esperanza Center, the health clinic is just one program, and we also have Immigration Legal Services, where we have a team of about 10 attorneys who represent our immigrant community in different kinds of cases. And I know particularly for our attorney group, the changing interpretation of laws has been really, really challenging throughout the last administration, and now as we transition into the Biden administration in terms of DACA recipients and what's going to happen with DACA and TPS, with things changing about TPS ending for certain populations and countries. And so so I know for them, they're constantly reliant on the feds to interpret different immigration laws. And so that can be quite challenging. Another program that we have at Esperanza Center that is really impacted by the political environment is our family reunification program. So we have a program that reunites unaccompanied minors who cross the southern border with sponsors here in the US. And as you all, I'm sure, have seen in the media, that has been very in flux with folks minors being returned to Mexico and being forced to remain in Mexico with that policy that was implemented in the Trump administration. And now the situation at the border since Biden has come into office, we've seen a huge influx of folks crossing the border and minors being held at facilities in the border for longer than they should, that we're trying to get to Maryland. So those programs are much more impacted by the political climate than mine is. But in the clinic, I would just kind of echo what Allison said about, almost all of our patients have experienced some form of trauma in their home countries, and many of them here in the US as well. And so the mental health needs are significant, and access to mental health care is a huge challenge for this population, kind of language congruent mental health care and affordable mental health care is a huge need for this population. And then I would also echo what Allison said about kind of the impacts of the pandemic on our community. You know, the economic impacts and the fact that they were not included in any stimulus packages or relief checks that went out by the federal government. And the rates of COVID and deaths and hospitalizations have been significantly higher in the Latinx population. And so that has all kind of played a part in, and I think the impact of the political climate on our community. Sorry for the long-winded answer.
No, that was great, Margie.
Well, I just want to mention that I took a tour of Esperanza Center the first time I was introduced to it, I guess in the spring of 2017, so right after the change in administration. And one of the things that we all noticed was all these little kids in the waiting room being photographed. And it was like, you know, the staff was taking pictures of them. And so we asked what was going on. Well, these were children who had been born in this country, and the parents wanted to make sure that they had US passports for them. So if they were deported, the kids would have passports. And it was like such a sinking feeling when I saw that. Anyway, Gilead House was set up to provide housing for adult asylum seekers, specifically single men. However, when Erica was approached in 2019 to take an 18-year-old who was aging out of a federal shelter for unaccompanied minors in Baltimore County, we didn't hesitate when we learned that if he did not come to Gilead House, he would go to an ICE detention center. And having this 18-year-old was really something we were not prepared for. And we've been learning on the fly. And I've been very involved with him, which is why Betty asked me to come here today. But it really changed our whole program.
Do you mind if I ask in what ways? Could you talk about that more?
Sure. So the people, okay, I'm talking from just my personal perspective as a volunteer. So I'm not really speaking for Erica. This is just what I experienced at Gilead House. The people who'd been there before were I think they were all asylum seekers from Africa countries. Some had their PhDs, they were college educated, they were here for political reasons. And their needs were they just really what they needed was housing and support. And the fact that Gilead House gave them a stipend and gave them a place to live so that they could focus on their immigration issues, most of them got asylum. This young man, on the other hand, is a kid. He doesn't have education. He doesn't know the language. He doesn't have any kind of family support and he has all the needs of an adolescent. So he just needs a way different kind of support than the other residents we've had in the past had. So to help.
Yeah, thank you for speaking about that more. I guess in terms of where to kind of guide this conversation along, Allison and Katie talked about the mental health impacts of the current political climate and issues around immigration. I was wondering if you all could speak more about what do you think the connection between immigration and public health is, and specifically kind of how can we define and expand our definition of health and well-being to encompass safety, security, and the social inclusion of all people, including immigrants and refugees.
I can jump in and take a stab. So I think the last year of this pandemic has really shown how connected we all are, regardless of immigration status, regardless of race or ethnicity. And you know, it's been interesting to see sort of services that have popped up that have become free to our undocumented community, who's often carved out of almost any type of federal service. And so, and now there's a lot of confusion on the part of our patients. Can I get a free COVID test? Can I get vaccinated? Am I going to be charged? Is this going to impact, is this public charge? Is this going to affect public charge? Can I share my information on a vaccine card? Is this going to be shared with the federal government and impact my status in the country? All those kinds of questions came up, and we had to reassure folks that yes, you can get vaccinated. Yes, you can go for a COVID test without insurance, and you're not going to be billed. But I think it was confusing for people because it was the first time that they were included in services like that. And so it's unfortunate that it took a pandemic for those kinds of services to be extended to all people. And CARES Act funding, which covers a lot of our patients who had extended hospital stays due to a COVID infection or ICU stays, they're not being billed, thankfully, due to the CARES Act. And again, there's all these questions that came up around public charge. And so I think we can do it. The pandemic has shown that this access can be extended to everybody. And while I'm a little bit cynical and don't think that that this will continue, it has shown that really, in order to improve the well-being of all of us, everybody must be included in these kinds of services. But yeah, I think it's been quite eye-opening for people. And when you think about the rates of COVID in the Latinx community in Baltimore City in particular, I mean, it's just staggering, the disparity in how COVID has impacted this community, both in rates of transmission, in hospitalizations, in deaths, for what is really a young, healthy population. And so why is that? Why are they being impacted? It's because they don't have any work protections. They don't have sick leave. They have informal work relationships where they can't stay home if their child is infected with COVID or if they've been exposed to COVID. And so we saw the spread of COVID in all of these workplaces that employed this population. And so and people who work in the service industry. And so it really, as we talk about essential workers and extending benefits to them, it's so critical. So
here, I can go next. Initially, when I first started working with immigrants, I assumed that the lack of health service for immigrants would be an issue. I found that, however, like at the Esperanza Center, there are services available, but as Katie mentioned, there are issues of access. Immigrants often don't know the services that are available, that these services exist, and that sometimes you can get health services without paying or having insurance. Front office staff at facilities that do offer low cost or no charge services need to be trained as to how to interact with immigrants in a way that's perceived as being welcoming. In addition, as others have mentioned, many asylum seekers have had traumatic experiences in their home countries or on their journey to this country. And this trauma may make them hesitant to go to a doctor. The young man I'm working with doesn't speak English, and that's made me aware of how important it is for immigrants to have translators available in healthcare settings.
Yeah, and I just want to second a lot of what Katie and Margie mentioned already. We have seen a lot of the effects of the pandemic really exacerbated in the students and families that we work with at CASA, particularly in regards to the issue of housing. So like Katie had mentioned, a lot of the families that I work with have essential jobs. So when things shut down, when a lot of people lost their jobs, they were not getting a paycheck. So a lot of families were at risk of eviction. dealing with landlords harassing them, even though there were rules that they couldn't, but they were still being harassed. And when you're an undocumented person, that can be very scary. And just dealing with that constant harassment, insecurity in housing, families that live in multi-generational households, that just increases the risk of the pandemic kind of going through a whole household. And in my students, I've seen the real effects of that, you know, the parents being really sick with COVID and the younger teens taking care of all the young ones in the household, not being able to focus on their school or their classes. And virtual learning is a whole other thing I could go into, but yeah, it's been really difficult for families, for their mental health, physical health, and that's really where CASA as an organization, we've been advocating for and fighting for eviction prevention rights and inclusion into the stimulus checks and those kinds of services that the immigrant community deserves. And unfortunately, it is not always recognized by federal and local governments because immigrants are essential workers and deserve access to those same benefits that residents of Maryland have.
Just to kind of piggyback on what Allison just said, in another part of my volunteer life, I do advocacy work, and CASA has just been such a leader in doing advocacy on the state level for renters and for the stimulus check. They had me send lots and lots of emails. And in fact, they had me send so many emails that one of my delegates texted me from the House floor when dignity not detention passed. So
and just, yes, I agree. CASA is a real leader in advocating for those kinds of issues for the community. I did just want to chime in that we, thanks to partnership with the city and some private funders, we launched a cash assistance program for basically for this exact reason that people were so impacted financially by the pandemic and were excluded from stimulus benefits. And so we have a cash assistance program where we provide cash payments of $800 to families and $400 to individuals who test positive for COVID. The idea being that it is an incentive for them to isolate for 14 days after testing positive. So we do have a fair amount of money raised for that program, and we work closely with CASA to receive referrals for individuals in their client community that test positive. And I did also just want to mention that the feds passed an EBT, a pandemic EBT program that will actually include undocumented folks. It's backdated to October, and it's for individuals who have minor children in the school system. So I think it's $5 a day. And it's, like I said, it's backdated to October. So anyone enrolled in Baltimore City schools, whether they're documented or not, their parents will receive that benefit. So it's one of the first benefits that was passed with this administration that will extend to our undocumented communities, which is good news.
That sounds amazing, and I'm really curious to hear more about that. So maybe we can get into that a bit later. But I just wanted to ask, I guess, one more general question, which was something that came up pretty frequently, or what I'm hearing a lot of is that it's not necessarily that services don't exist, it's that people aren't aware of those services or aren't aware that they can access those services. And I'm sure, especially for immigrants who are undocumented, there might be some distrust in terms of being able to access those services. So I was just wondering, kind of more generally, how have you and your organization's been able to build trust with immigrant and refugee communities, and what does that trust building look like?
I can go first. I think first and foremost, trust building takes time and effort. Even in your personal relationships, trust building takes time and effort. But when you're looking at community-wide trust building, that takes people boots on the ground, out in the community, talking to community members, getting to know community members face to face and or screen to screen. And a lot of the work in terms of accessing the immigrant community is making sure there are a variety of ways that people can use or reach a service. So for example, when the pandemic hit and suddenly everything went online, a lot of immigrant community members were not prepared, up to speed on how to computer literacy. Some immigrant community members have interrupted education, so some are not fully literate in their first language, let alone English. So that transition has been another difficulty, another barrier placed on the immigrant community. And that's why it's so important that services at CASA, Esperanza Center, Erica exist, because these services can be that door opener to access for many of these programs, particularly when Baltimore City opened up their eviction prevention program. It's a great program, but the application's in English. It's a long application. It's online. So that's where service providers come in and are able to really bridge that gap of access between the community member and the service being provided or offered. So yeah.
Yeah, I just kind of chime in and echo what Allison said. One thing that is clear in the literature, and we've had success with at Esperanza Center, is using a promotora model. So just a community health worker that is from the community delivering messages out on the ground in the community. And I know CASA uses community health workers more extensively than we do. So, and we had started using promotoras before the pandemic hit, but since the pandemic, we've relied on them even more heavily. We launched a COVID-19 hotline back in March at the beginning of the pandemic, when messaging coming from the CDC and the feds and then local government was, if you're experiencing symptoms, call your primary care provider to get a COVID test. And as we know, many in this community aren't engaged in the healthcare system. And so we launched a line staffed by promotoras where people could call and get access to a test. That line still exists today, and we're still testing, but we're also now vaccinating in the community. And we send our promotoras out onto the street. They go to Latino grocery stores, they go to churches, they go to community centers, and they talk with folks about the vaccine, and they sign them up right then and there for appointments. And it's been really effective in getting folks vaccinated and tested and services around COVID. It's how we administer cash assistance, food assistance, and all these things. And so I think going forward, post pandemic, we'll continue to kind of lean into that community health worker model, because as you mentioned, large institutions like Hopkins or the local governments, that there is a lack of trust there, and it's hard for those large institutions to deliver that message. And so we found a lot of success with this promotora model of sending people out into the communities. And so I think we'll do that hopefully even outside of COVID as well.
Well, Erica is way, way smaller, and just, as I said, a staff of 1 and volunteers. But the same thing. I know Betty told me that she spent hours with one of the clients, not a Gila House person, but one of the other Erica clients, walking them through how to apply for unemployment insurance. So it really needs to be one-on-one. And I know with the young man I help, I just have to be there sitting with him one-on-one. That kind of support is really very effective.
Great, thank you all so much. I was hoping we can maybe transition a bit to talk about specifically what are some initiatives or specific projects that students can get involved on. So I guess for each of you and your organizations, how have students been able to get involved in your work in the past? If you could kind of share some examples of student involvement.
Well, I can, this comes from Betty. She gave me it because I wouldn't know. But Erica is an active consumer of Source offerings, including Source Scholar and the Source Service Learning Program. And through Source, a group of students created a logic model for Erica that continues to be used.
Okay, great. Thanks for sharing. Katie and Allison, do you have anything to add?
Yeah, so we actually have a pretty strong relationship with all 3 of the schools, with the School of Nursing, the School of Public Health, and the School of Medicine. So we have internal medicine faculty from Hopkins who sees patients at our clinic, and we host urban health residents every year for a rotation. We also train nurse practitioner students from the School of Nursing, as well as undergrad students rotate through on their public health nursing rotation. We actually have 2 Source students working on our COVID-19 hotline right now. They've been with us for this semester, scheduling folks for COVID testing and COVID vaccination. And we rely heavily on volunteers, and I would encourage everyone, I'll put my email in the chat. We often, folks who are interested in clinical rotations, we welcome you to come and spend time with our clinicians, shadowing, seeing patients. And then we also have, for folks that are on the public health side, we do have quite a few programs that we run that we often look to MPH students for monitoring and evaluation support. So different grants that we're operating in the diabetes space, in the COVID space, that we love to rely on MPH students for that kind of evaluation support. So I will put my email in the chat if anyone has any interest. Many of these opportunities do require individuals to be bilingual in Spanish and English. Some do not, though, so do reach out regardless of language ability.
Yeah, and at CASA, we have a variety of opportunities for students to volunteer with us in a variety of different departments. Definitely in our department with youth education, if you're interested in working with youth, even in a health aspect, either joining with the Salud program and joining in on the mental health lessons, or if students want to do a few workshops with students talking about other kinds of health, we would love to hear from Source to deliver those workshops or orientations. I know in the past, some Source interns have partnered with CASA before, and we are also welcome to that opportunity. But there are other opportunities to volunteer with CASA as well, with our food access programs. If you're more interested in advocacy, we always need volunteers in our advocacy work, particularly multilingual people, bilingual people. So if you're interested in getting involved with CASA, I'll put a link in the chat, which is our volunteer interest survey. So you can select one or all of the things you're interested in joining with CASA to support the immigrant community here in Baltimore.
Great, thank you so much. And I'll make sure to circulate all of these, all the emails and the links to people in case they're interested in getting involved. And actually, I was wondering, since Margie, you yourself are a volunteer and you work as a volunteer in Erica, maybe you can speak to more of your experience, or what do you do on the day-to-day as a volunteer with Erica?
So I work, what I've been doing intensely since July is working with the 19-year-old, she's almost 20, and helping him with virtual learning. He had, well, when he came at 18, you can go to school till you're 21. And so we thought it would be a good thing for him to go to school. So he's at Owings Mills High School. But he hasn't really picked up English very well there. He loved playing soccer, but, and so I work with him with virtual learning, kind of translating things for, like, I do not speak Spanish. So we totally rely on Google Translate, which is not necessarily the best way, but you can do it. And so I kind of translate what the teacher's saying to keep him on track. And then the materials I translate into Spanish for him, and we work together. So that's, and through that, I've created a relationship with him. So I'm hoping that relationship will help me convince him to get a vaccine. That's my next challenge.
Yeah, actually, I think that is kind of, again, a good segue in terms of thinking about trust building. How has kind of the pandemic and building trust for COVID testing and vaccines? I'm not sure if Katie or Allison, if you can speak to that.
Yeah, I can.
Go ahead.
Sorry.
No, you go.
Yeah, so CASA has been doing amazing work with getting the community to the Baltimore City Convention Center vaccine site on Fridays so far. We have a few other partners that we're looking to open up a partnership with, so we can provide vaccines on Saturdays as well. But like Katie had mentioned earlier, a lot of the work in terms of getting the community connected to vaccines, feeling comfortable about vaccines, has been through our community health workers. So people that speak the same language, that can answer questions directly in the moment you're making the appointment. And part of the model that CASA has been using to get people to the convention center is also providing transportation, which is another huge barrier for the immigrant community. So we have a shuttle that takes families from CASA to the convention center and takes them back. So they're always with a CASA staff member at any point of the process. And that has been a way that we've been able to build trust and confidence and make sure that no vaccines are being lost. People are getting to their appointments and receiving support in their language. And something that we did particularly with our after school program students and their families to build confidence in the vaccine is having vaccine info sessions with our families as well. And giving them that opportunity to sign up for a vaccine after hearing all that information, and maybe some of their worries were answered in that session. So it gives them the confidence to actually follow through and sign up for a vaccine appointment.
Yeah, and I'll just, so we've been vaccinating since the first week of February through a partnership with the National Guard and the Maryland Vaccine Equity Task Force. So we hold weekly vaccine clinics in the community at a local Latinx church, and we've been doing so since the beginning of February. We also have, similar to CASA, we have designated appointment slots at various facilities throughout the city, including the Convention Center and University of Maryland. We have not found as much hesitancy as we expected. Many people that we are speaking with about the vaccine didn't know that they were eligible and didn't know how to get it, but are very thrilled with the opportunity. And so we haven't seen quite the hesitancy that I think sometimes you hear about in the media or even that we expected. So that has been encouraging. We've vaccinated almost 2,000 individuals to date. We also partnered with FEMA to do some pop-up clinics on street corners when Johnson & Johnson was in circulation. Unfortunately, obviously Johnson & Johnson is not available now. So those kind of pop-up on the corner clinics, they got shut down because you can't do it with a 2-shot vaccine. But we will continue to vaccinate at churches and at the convention center. I do think, you know, I guess this applies to everyone, not just the immigrant community, but we are going to get to a point very soon where we're having to go kind of find people and do some more convincing. To this point, it's just been kind of incoming calls and fielding interest, but I think that's going to shift fairly quickly.
I have to say that it's not hesitancy, it's more fear of the shot, not liking shots.
Yeah, I find that,
yeah.
I find the exact same thing. It's more I know I'm going to have side effects the next day and I can't take off work. So I can only do it on a Friday night or on a Saturday morning. And so making sure that we have vaccine clinics at those times for folks so that they, because I think, yeah, you're right. It's that fear of the side effects. It's less about, hesitancy, true hesitancy.
Yeah, that's a great point. And also really great to hear that Esperanza is working to help distribute those vaccines. Lena in the chat said, I've used Google Translate working with refugees and it has been great. While not perfect, it still allows you to communicate and connect. So that's also great to hear. I did want to kind of save some space for people to be able to ask questions or if they had any thoughts or things that they wanted to add to this discussion. So feel free to either put something in the chat or unmute if you wanted to ask. Azat, did you want to unmute and ask?
Sure. Yeah, thank you so much to everybody for this incredible discussion. It's really been fantastic to hear from all of you. So I really just wanted to kind of go back to something that Katie brought up around TPS, and just had a question for you, Katie. If you could speak a little bit more about some of the issues around TPS, what communities might be kind of affected in Baltimore or in Maryland, what countries are still on that list, and also kind of in follow-up, what are some of the fears that folks are facing who are currently protected under TPS, but may be at risk for some kind of further action down the road, like deportation or losing their right to work?
Yeah, so I'll answer that as best I can, although I will say I wish my colleagues from our legal services division were here because they're much more well-versed in TPS and the implications. But so I believe there are 6 countries that qualify for TPS, which stands for temporary protected status, which means that, and it's Haiti, it's Guatemala, it's Honduras, I think, Haiti, Guatemala, El Salvador. There's like 6 and 1 from the Middle East. But anyway, they're countries who've been impacted either by natural disaster or government oppression, and they've been granted temporary protected status to come to the United States and live without fear of deportation, and they do have the ability to work legally in the country. And so during the Trump administration, he put an end, he set a sunset date for certain countries' TPS protected status. And so it all was a bit in limbo because it ended up going to the Supreme Court. And to be honest, I'm not sure exactly where we stand. I know that Nobody has actually had their TPS revoked at this point, but I think there's a date in the future when some certain countries are going to expire. I think that the biggest impact is just people are in limbo because there's no clear resolution to how long TPS status will last. And so I think people, it's hard for people to plan for the future when they don't know how long their status will be valid. But like I said, I could certainly connect you with folks from our legal team who can give a much more, a better answer to your question.
No, that's great. Thank you so much. Appreciate that.
Can I add something as well? I also wish our legal team was here as well to give you a clearer picture. But I know that at CASA, we have been fighting to extend TPS to the countries that it's already extended to, extend the time frame, but also extend TPS to other countries, particularly other Central American countries who have recently experienced horrible natural disasters. So that's definitely something that is currently in the process, as well as fighting for a larger immigration reform. And if I can pitch something really quick to students, anyone who wants to get involved in advocacy, CASA is, and many other organizations are promoting a huge march for immigration reform on May 1st. It'll be in Washington, D.C., and we are hoping to convince the administration to comply with the promises they made for immigration reform when they got elected. So I would love to see some Hopkins students there on May 1st.
Yeah, I will definitely be putting that down in my calendar. I'll try to make it over there. Are there any other questions that people wanted to ask? Okay, if not, maybe we can just kind of summarize maybe some opportunities that people can take now. I know, Allison, you mentioned that CASA de Maryland is trying to reform their youth programs and partnerships with Source. And Katie, you mentioned a lot of different projects that Esperanza is working on. So if there's any kind of projects that you would like volunteers for now or in the near future, and Margie, you're more than welcome as well to add to this. Yeah, if there are any kind of initiatives that you're working on right now that students can get involved in.
Well, Erica's part of a working group on vaccine messaging and access to vaccines, and which goes along with what Katie and Allison were saying. And they're committed to making sure that Erica program participants and members of their broader communities have information on how to access the vaccines. So students could certainly help with the effort to provide outreach.
I can go next. Yeah, so we have opportunities for students to volunteer, particularly with the youth program, in two aspects. We always need volunteers to support with academic support. And particularly for those of you who are in the health field, a lot of our students have aspirations to go into the health field. So I really think that having you there to support those students one-on-one is really a great opportunity for their mentorship and growth. And then the other aspect would be in the form of re-engaging the Source internship or providing health orientations within our youth programs. And then the other opportunities with other departments at CASA would include getting involved with advocacy, translation support, and I think there are a few other opportunities on the volunteer interest survey that I sent out as well. So I would encourage you to take a look at that.
Yeah, so I would say for us, it's really around the COVID work that we're doing. We're always looking for support on our COVID-19 hotline. On the one side, we've got some data work that we could always use support with. We've got over 5,000 callers, and we're part of several different research projects through Hopkins and NIH, looking at that subset of people who've sought care or services through the hotline. So that's one. The data side is one piece, and then the service delivery, so helping to kind of answer calls from immigrant community members. And then, like I mentioned before, the other side would be on the clinical side of things. We do rely heavily on volunteers in clinic to help us triage, to help us get patients back to their rooms, escort people out, help people with paperwork, things like that. And then, as I mentioned, the clinic is just one small part of Esperanza Center. So we do have a volunteer coordinator who links volunteers who are interested in working with our attorneys, with our family reunification program, and the other programs at Esperanza Center. So I'm happy to put our volunteer coordinator's email in the chat, and you can reach out to her directly if you're interested in those other programs. And I do have one other. We are looking for, I don't know if there's MPH students here, but it doesn't necessarily have to be an MPH. Or if anyone is looking for capstone work, we do have a diabetes self-management program, which is our diabetic patients enroll in a small group self-management program where it's class 6 weeks, once a week, where they learn kind of how to better manage their disease. And we're looking for some M&E support on that grant. It would be a semester-long opportunity, roughly 5 to 6 hours a week. And so we'll be looking to fill that position sometime this summer. So I think I put my email in the chat earlier. If anybody's interested in chronic disease work, that opportunity exists as well.
Okay, thank you all so much. I feel like this was a great conversation, and also some great ideas for how people can get involved. And I'll make sure to send out all of this information all together in a follow-up email. So thank you all for joining us, and yeah, we'll see you at our next event.
Thank you all.
Thanks, everyone.